Hi everyone, I'm Dr Sanjana VB and you are watching me on Siahmsr channel, and today we are going to discuss another homeopathic drug, Hepar sulph, a commonly indicated drug for many clinical conditions, a simple drug. All of you know the relevance of Hepar sulph in the wake of COVID-19. Hepar sulph is used for treating lung affections and pneumonia and many kinds of cough related to COVID and other ailments. And before going into the details of Hepar sulph, I would like to speak a few words about innovations in homeopathy, innovations in materia medica. We have to add to our materia medica. That's a duty of homeopathic physician. And I appeal to the young generations to incorporate that habit of adding to materia medica. We must keep a note of our own materia medica. That means a notebook of materia medica where we add our clinical experiences related to a drug. It may not be available in the materia medica written by the pioneers and stalwarts. Okay, then so that will add to innovations in homeopathy. That will be a great movement towards development in homeopathy or taking homeopathy to new horizons. Okay. We have to add a particular remedy is useful in a particular clinical conditions, and we chose that drug based on the symptoms written in the materia medica, but the clinical indication is not in the not mentioned in the materia medica. Hope you get the point. So that adds to our materia medica. That's an innovation. Innovation in homeopathy is important and it is very essential. Now COVID has given us an opportunity to raise homeopathy to new horizons of healthcare. I know the issues related to it, yet many doctors are endeavoring or taking effort to use the potential of homeopathy in treating COVID, and we have proven our treasure in homeopathy, our treasure of homeopathy, which is capable of dealing with any pandemic arising in future. The strength of homeopathy. Okay. Now coming back to Hepar sulph. Hepar sulph is indicated for lymphatic constitutions mostly. There are many glandular ailments in Hepar sulph. There will be chronic lymphadenitis with no reason, and sometimes may be related to the tubercular trait. And chronic lymphadenitis may be related to a suppurative and non-suppurative category. Hepar sulph is indicated for persons with lax muscles, light hair, and light complexion. The constitution, physical constitution, although we mention as it is written in the textbook, it is applicable to all kinds of constitutions. That's my clinical experience. I use the same dark complexion people and thin and obese people. What we look at the drug for choosing it as a remedy is the symptom similarity or the general symptoms. Okay. And what are the general symptoms of Hepar sulph? Sensitive to cold air. All of you know that very well. Hepar sulph is a drug just like Sorinum. Hepar sulph is sensitive to cold air, cold winds, and exposure to cold. And all the ailments are stemming from cold exposure or aggravated by cold exposure. And the sensitivity of Hepar sulph is not only related to the cold, but also to many other external impressions like touch, pain, and mental stimuli, etc. Hepar sulph is very sensitive both at physical and mental planes. And next important feature of Hepar sulph is suppurative tendency, just like silicea, belladonna, acid nitricum, and mercurius, all the mercury compounds. Many other drugs are the myristica, Mirica, and many calendula. All are the drugs belonging to the category of drugs with suppurative tendencies. How Hepar sulph is different from all these drugs. The stage of inflammation which produces the splinter-like pain. That is the characteristic of Hepar sulph in suppurative tendency and in many other ailments related to Hepar sulph. The suppurative tendency is very prominent in Hepar sulph, but at the second stage, not at the first stage and not in the last stage. It stands between Bell and Silesia, Bell and Mercurius. Actually, there is another version, that is Mercurius. Mercurius is not going well with Hepar sulph before and after. Actually, Hepar sulph stands between Mercurius and Silesia. After Mercury, it's not wise to give Silesia. Many stalwarts have written like that. I haven't verified it in my clinical practice. But Hepar sulph, if given after Mercury, it's okay. But usually in my clinical practice, I don't go in that way. I usually take belladonna or any other indicated drug in the first stage, and after that I go for Hepar sulph straight. Mercurius I choose as a third stage drug. In my experience, it's like that, and many other doctors may have their own versions regarding that. And the Hepar sulph is indicated for cough. What kind of cough? Barking, ringing, dry, hacking cough. And it's also indicated for loose cough, productive cough with rattling, asthma, wheezing, and the wheezing is better by sitting and bending head back. Hepar sulph is indicated for tracheitis, lung inflammations, and pneumonias, especially in COVID-19. Hepar sulph is a wonderful drug for treating pneumonia, and Hepar sulph is indicated for ulcers, phelon and abscesses, boils, etc. Many skin ailments, acne, but the stage of inflammation makes Hepar sulph different from many other drugs with the suppurative tendency. It's indicated for imminent suppuration. That's the red line symptom of Hepar sulph. Be it ulcer, be it quinsy, tonsillitis, tracheitis, pneumonia, whatever it is, there will be the splinter-like pains, or the patient may be in distress because of the either cough in case of lung affections. In case of skin ulcers and abscesses, there will be imminent suppuration, and the throbbing, sticking, splinter-like pains keep the patient very anxious, restless because of the pain. Already Hepar sulph patient is very sensitive to pain, and this pain makes the patient very crazy, and there will be imminent suppuration. That means we can see the yellow spot over the boils or the abscesses, and ulcers also. Touch is very characteristic modality of Hepar sulph. Hepar sulph cannot tolerate touch, just like lacosis. And Hepar sulph is indicated for fevers with profuse sweating, and the sweat is offensive, sour sweat, profuse sweat. Hepar sulph is indicated for both psychotic and syphilitic ailments, apart from psoric element present in Hepar sulph. The psychotic part is manifested in figwards and herpes and genital growths. It's a remedy for recurrent boils we see in skin on the exterior part of the body, as well as in the genitals, in the vulva, especially in females. There will be recurrent boils in that region. We can give Hepar sulph in the second stage when there is imminent suppuration and stabbing pains and incapacitating the patients to move. I have great results from using Hepar sulph in such cases in our gynecological OP, and we can use is a drug as a drug for intermenstrual bleeding. We have many other drugs which we usually don't go for Hepar sulph directly. Am I right? We go for millifolium, trillium, erigeron, and ustilago, and many other potencies like hamamelis, lactosis, etc., etc. Especially depending on the symptoms. Sometimes we use specifics also if the bleeding is very huge and patient is in distress. But Hepar sulph is indicated based on generals in intermenstrual bleedings. The same chilly nature, oversensitive pain, etc. and the modalities and covering is very problematic for Hepar sulph. And the Hepar sulph mind. We use Hepar sulph both in acute and chronic ailments alike. And in chronic ailments, we have to understand the mind of the person. Hepar sulph is a very deep-acting drug in that aspect. It's indicated for irritable people, quarrelsome people with impulsiveness and insanity. At the extreme stages, we may get insanity. Not in every Hepar sulph we cannot find the insane nature. Irritability and quarrelsomeness. What is the cause? Why Hepar sulph is irritable? Hepar sulph is dissatisfied, wants changeability in life regarding persons and things. Because of that, very irritable and in impulsive also, hasty speech, hasty actions. The haste that is very prominent in Hepar sulph and Lilium tig. The reason is different in Lilium tig, but in Hepar sulph, the impulsive nature is we usually see in degenerated state of mind. Because of impulsive, insane mental state, Hepar sulph take impulsive steps or very dangerous steps, like throwing the child into the fire, and if a woman with suicidal tendencies tries to set herself on fire and tries to stab a friend with knife. And all these are very characteristic of Hepar sulph in degenerated psychiatric ailments. And another important feature that we usually get in common means not degenerated, but usually see in acute cases and all. We get anxiety in Hepar sulph. Anxiety about disease is there. Hypochondriacal nature is there. And Hepar sulph is indicated for gum swellings, corneal ulcers, cracks in the middle of lip, and bladder catarrh, the stricture of bladder, urethritis, gleat, gonorrhea. Gonorrhea is very characteristic because I have already mentioned that Hepar sulph is useful in both syphilitic and psychotic ailments. Both miasms are there. Not only syphilis and psychosis, but SORA also is there. Many functional symptoms are also there, apart from the degenerations and overgrowths. And the relations of Hepar sulph. It's complementary to calendula, and Hepar sulph is complementary to calendula and iodum in Silesia. Antidote is Silesia chamomilla, and the lower potencies of Hepar sulph hasten suppuration, and higher potencies aborts suppurations. We all know that, but I mentioned the important principle regarding Hepar sulph for the juniors. And in mental ailments, the potency, in my experience, most usefully is 1 in mental ailments. If there is a lower level of insanity, if we find in a patient who comes for a physical ailment and we find that a patient is very impulsive and very anxious and very hasty, then we can give 1 potencies better if there is no suppurative or imminent suppuration. And what is the innovative symptom of Hepar sulph in my experience? All these are the general symptoms of Hepar sulph. In my experience, Hepar sulph is useful for gynecological ailments. As I mentioned earlier, it's useful in crops of ailments, crops of boils. Crops of boils means usually it comes at the mucocutaneous junction, just like acid nitricum. Hepar sulph is also indicated for boils, abscesses, and erosions coming in mucocutaneous junctions, on the genitals, on the lips. It's already mentioned in one of the clinical indications of Hepar sulph. You know, herpes genitalis. Herpes is a vesicular eruption and usually found on the mucosal surfaces of mouth or genitals, and Hepar sulph is indicated. Similarly, boils also on these mucosal surfaces. Hepar sulph is indicated. We can add to our materia medica that it is its action is prominent in mucocutaneous junctions, just like acid nitricum. Sometimes acid nitricum can be used later once the pus has expelled and the pain is relieving. Either we may repeat Hepar sulph. If it doesn't relieve, we can switch over to acid nitricum hypotensis. There is such a relation that I felt in my clinical practice. And it's a remedy for pharyngitis, sore throats, cold air aggravates it. All these are the clinical indications of Hepar sulph. And the sensitivity of Hepar sulph to noises, that's also relates it with acid nitricum. In my view, no textbooks speak about it. You too can share your views regarding Hepar sulph and your clinical experiences and its relations you find with other drugs in your clinical practice. Do add comments in the comment box, and we are happy to receive your feedback regarding Siahmsr lectures. And stay safe, stay healthy, take care of yourself from COVID. Thank you.